The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. We've covered a great deal of the One Big Beautiful Bill Act over the past many weeks. I've made numerous points. One is that not everything in the bill was terrible. We do need accountability, and some reforms were not off base. I also said that I wanted smarter cuts, such as those that would really help reduce healthcare costs rather than simply target coverage eliminations. This will simply mean costs go up in higher cost settings when people seek care, and everyone ends up paying anyway. But in general, as you know, I'm an affordable universal access Republican. That's a bit unique for my party. I think affordable universal access is a moral and economic imperative. And most of the cuts in the Big Beautiful Bill, as it is known, will be anything but that for about 15 million Americans who will be losing coverage, if you include expected losses when the enhanced premium subsidies in the exchanges expire as well. That has gotten me to thinking about the topic of this week's podcast. It has been on my mind of late that two forces are coming together now to further erode coverage in America over the next decade. Those points are surging utilization and, of course, the One Big Beautiful Bill Act. We will take 2 breaks today to make this more digestible, so let's get right to it. Let's start with the first of the 2 issues, surging utilization. Some of the surging utilization can be explained. A return to normal post-pandemic utilization, increased expensive drug introductions, aging, and more. But some of it cannot be explained. While healthcare actuaries anticipate a slowing of annual healthcare growth in a few years, I think we could be in a new era of even more robust annual growth. After all, right now we are seeing cost spikes annually of between 6 to 9% a year, depending on the line of business. This is especially true for employer and commercial coverage. When utilization spikes here, as much as employers try to protect employees, more costs are foisted upon employees or coverage evaporates. Let's turn to the second issue, the One Big Beautiful Act's impact. So this second issue, of course, is coverage losses in the One Big Beautiful Bill. GOP lawmakers and the president are in campaign mode and say something like this, quote, "No one is being kicked off coverage unless they are fraudulently obtaining it or they want to be tossed off." But we know the reality is a bit different. Medicaid provider tax and state-directed payment reform, new work requirements, and tighter eligibility rules will mean about 10 million lose coverage in that program. Exchange changes, including expiration of enhanced premium subsidies, mean another approximate 5 million lose coverage there. Most recently, we have seen an uninsured rate of about 8%. That was in Q1 2024. This is well below the uninsured rate before the Affordable Care Act's Medicaid expansion and exchange coverage went into effect in 2014. The recent uninsured rate peaked at 16% in 2010. The most recent 2024 rate is up from a recent historic low of 7.7% in 2023. The return of Medicaid redeterminations and ongoing coverage erosion helped push the uninsured rate back up a bit. But with the OBBBA, we are clearly in store for higher uninsured rolls. The Congressional Budget Office estimates that the uninsured rate will increase to 8.9% by 2034, a significant increase from 2023, and it will be on a much higher population base. My fear is the combination of utilization hikes and the One Big Beautiful Bill actually means a higher rate of uninsured than what CBO anticipates. It is hard to imagine that many losing Medicaid or the exchanges actually make the leap back to coverage. With that, we will take our first break, and when we come back, I will tell you about what I think is an even bigger problem. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you are enjoying this edition of the Healthcare Labyrinth Podcast. We are talking about two forces, surging utilization and the one big beautiful bill, and a worrisome problem about coverage in America over the next decade. Before our first break, we discussed the likelihood that the uninsured rate will jump considerably and erode some of the great work done through expanded coverage. But as I noted, I am worried about something even more. Because of the fundamental lack of healthcare reform in America, we actually have a bigger problem than just the uninsured rate increases. As much as we worry about the uninsured, the underinsured is an even bigger problem, and the underinsured rate likely will grow even more than the uninsured rate. Again, high prices, inflation, utilization, and overall trends eat away at most Americans' ability to afford health care, even if they are covered. This fundamental lack of affordability is most seen in commercial or employer coverage, as well as in the exchanges. When price and trends are out of control, products in these lines of business tend to erode, whether it is via higher premiums, higher deductibles and cost sharing, or reductions in benefits. Each plays its role in making services unattainable for many. People have to make choices between paying the rent, putting food on the table, or getting a needed healthcare service. Statistics show that foregone or delayed care is a huge problem in America for those with no insurance, gaps in coverage, or those who cannot afford to access care even if they are covered. Now, some innovations in the employer world, such as pairing direct primary care and high-deductible health plans, could help address the issue of the underinsured. But innovation in the healthcare sector is not that great. While I support health plans, most have held on to the old ways of doing things and are quickly falling behind. Standard healthcare offerings are still the vast majority of things out there, and the shopping is the only thing most businesses can do. How extensive is the underinsured crisis? I looked to a biennial survey from the Commonwealth Fund. The latest is from late 2024. You can see the link in my August 28 blog at the blog tab of healthcarelabyrinth.com. Commonwealth also does the fabulous Mirror reports every 3 years. They look at America's healthcare system performance against other developed countries' systems. In its latest underinsured survey, Commonwealth finds the following. First, unaffordability leading to being designated underinsured means at least one of the following applies. A, out-of-pocket costs over the prior 12 months, excluding premiums, were equal to 10% or more of household income. B, out-of-pocket costs over the prior 12 months, excluding premiums, were equal to 5% or more of household income for individuals living under 200% of the federal poverty level. Or C, the individual or family deductible constituted 5% or more of household income. Second, more than half, 56%, of U.S. working age adults were insured all year with coverage adequate to ensure affordable access to care. Third, 9% of adults were uninsured. Fourth, 12% had a gap in coverage over the past year. Fifth, 23% were underinsured. They had coverage for a full year that didn't provide them with affordable access. Among adults who were insured all year but underinsured, 66% had coverage through an employer, 16% were enrolled in Medicaid or Medicare, and 14% had a plan purchased in the individual markets. So as I inferred before, the biggest problem is with erosion of employer coverage. About 57% underinsured adults say they avoided getting needed health care because of its costs. About 41% of working age adults who reported a cost-related delay in their care said a health problem had worsened because of it. About 42% of adults who didn't get care because of costs said it was for an ongoing health condition, 29% said it was for a new health problem, and 28% said it was for both. As many as 3 in 10 people with a chronic health problem, such as diabetes, said that the cost for prescription drugs to treat the problem had caused them to skip doses or not fill the prescription at all. About 44% of adults said they had medical or dental debt they were paying off over time. Nearly half with medical debt are paying off $2,000 or more. About half also said it stemmed from a hospital stay. With that discussion of the potential underinsured crisis increasing, we'll take our second break, and when we come back, I will tell you about where we go from here and conclude. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this edition of the Healthcare Labyrinth Podcast. We are talking about two forces, surging utilization and the One Big Beautiful Bill Act, and a worrisome problem about coverage in America, specifically the likelihood that both the uninsured and underinsured rates will jump considerably over the next decade and erode some of the great work done on expanded coverage. So where do they go from here? Well, Commonwealth calls for extending and making permanent the enhanced premium subsidies, covering those in states that have not expanded Medicaid, and making Medicaid eligibility easier. It also calls for reforming cost sharing in the exchanges and in employer coverage. It also wants aggressive utilization and price addressed. All of these suggestions are reasonable ones, although I do think we need to protect against fraudulent enrollments in government programs. But alas, overall, the One Big Beautiful Bill Act mostly goes in the opposite direction and massively restricts coverage instead of undertaking true healthcare reform. I've called for 3 main tenets to healthcare reform. They are ensuring affordable universal access, reforming price, and emphasizing primary care, health, wellness, prevention, and care management. We really need to end our obsession with utilization management and prior authorization. So we are clearly in a crisis. It is clear that the uninsured and underinsured rates will rise dramatically over the next decade because of utilization and the impacts of the One Big Beautiful Bill Act. They will rise because of misguided policies and the lack of true healthcare reform. With that, we will end this edition of the Healthcare Labyrinth Podcast. We'll see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.